of soaking up the sun. We know our winters are brutal. That's why we take advantage of the hot weather when we can get it. And Dr. Mariana Atanasovsky says a few rays are good for us.
We do need to have some level of sun exposure just to maintain vitamin D levels, but it's really not that much. We only need about 5-10 minutes a day to maintain our vitamin D required for our body.
And taking the necessary precautions when we head out only makes sense.
But I know in the summertime, because we only get about 3 good months in Michigan, you just want to make sure you protect your skin well. So you don't want to go out during peak hours, and if you do, you want to make sure that you're wearing a hat or sunglasses, or you're just smart about protecting your skin and applying sunscreen often.
However, the numbers are just staggering. 1 in 5 Americans will develop skin cancer in the course of a lifetime. That's why doctors say it's so important to get a skin cancer check to detect and diagnose early.
During a skin cancer screening, we're looking for any spots that are either not healing, anything that kind of catches our eye as far as being like a sore that's just quite not healing, as we said, something red, something pearly, something that doesn't quite match the rest of the skin.
We are in the exam room now where Dr. A has a device that she can detect abnormalities in the skin and just take a general look at the skin. Tell me what that's all about.
So this is a dermatoscope, and what it does is it helps us look at the pattern and like the pigment pattern on any spots on the skin. So that will help me determine if a spot is benign or non-skin cancerous, or if it's something more of a pattern for a skin cancer.
Okay, and I'm going to have you do a quick exam on my arm, and I want to ask you a couple questions while you're doing that. What causes melanoma, doctor?
So different things can cause melanoma, number 1 being sun exposure, and number 2 being genetics. So both of those factors come into play, and although we can't change our genetics necessarily, we can definitely prevent some accumulation of sun damage that we get.
Now, can you spot melanoma on yourself?
You can. So, typically, patients do come in for a spot check, and, a lot of times they will detect melanoma on their own skin. Unfortunately, a lot of times when they come in, that they notice these spots when they're thicker than when either a physician performs the exam or when the patient is performing a routine self-skin check at home.
Doctors have made it easy to look for signs of skin cancer. They call them the ABCDEs of melanoma.
The A is asymmetry. So it's when we're looking at a mole, we want to make sure that it has a nice mirror image. You're able to cut it in half and it looks the same on both sides. The B stands for border. So anything with a smooth, even border is typically normal. We don't want to see any jagged edges or any little feet poking out of any one side of that mole. C is for color, and that's if a spot has more than one color, then that might be a red flag. D is for diameter, which is any spot that's more than 6 millimeters, and that's about the head of a pencil eraser. And E is for evolving or enlarging. So if you notice a spot that is growing, changing, it's itchy, it's sore, it's bleeding, that is also a red flag.
Statistics show 1 person dies from melanoma every hour in the U.S. But with early diagnosis, treatment, and crucial skin cancer screenings at least once a year, doctors say lives can be saved. I'm Cam Carmen for Allure TV.
Take a good look at yourself. Oh, yeah. And turn. Oh, very nice. Check that smooth backside one more time. No, really. Check it. Do you see any changing or suspicious spots? It's your skin, and it's important. If you're a man over 50, you're in the group most likely to develop skin cancer, including melanoma, the cancer that kills 1 person every hour. When detected early, skin cancer is highly treatable. Check yourself out and find someone else to help. Learn more about what to look for at spotskincancer.org. A message from the American Academy of Dermatology.